I'm here to celebrate Barbara because she was a wonderful person with a great heart, and her husband's the most generous person. And I want to get the word out that as a community we can help patients with breast cancer. We can try to cure it, prevent it, and the importance of what we hear today is to really help the patients who actually have cancer. We started a foundation to help patients who don't have the family support to be able to get them back and forth to treatments, to help pay for their cab fares, to help pay for their co-pays. Because those of us who have family support don't realize what it's like for someone who doesn't have the family support to go through cancer. And through our generous efforts, we're able to try to alleviate some of their distress by making sure that they can get back and forth to appointments, making sure they don't have to worry about the stress of the money, and making sure they can help pay for their medications. Typically, some patients are seen every week for their treatments and their chemotherapy, and it is really incredibly difficult to get onto public transportation after having had chemotherapy. And this is truly an example of, one person can make a difference. Every donation helps a patient with cancer get through their difficult time. Patients get chemotherapy for the average of about 6 months, and that's a very, very difficult period. And they may not be able to work, so they may not have the extra money to be able to pay for cab fares. We want to make getting through their treatments as easy as possible, to be able to give them the support that they don't always have from loved ones, or don't have loved ones who can support them.
Women are usually the primary caregiver in the family, and they don't have time for themselves, so they'll spend all their time taking everyone else in their family to the doctor, but they're not going to put themselves high on the priority list to get themselves screened. For women who are worried about what their parents went through, times are changing, and a major thing in the last 2 decades has been the rise of breast conservation surgery, where we are doing a small lumpectomy on the breast and then adding radiation therapy to that woman's treatment. The idea is to try to conserve the look of the breasts as much as possible without the disfigurement that goes along with a radical mastectomy. In those women that need a mastectomy, we have the ability to rebuild them immediately. We don't do radical anymore. And there's a whole range of plastic surgical options for those patients, for immediate reconstruction, with implants, with tissue transfers, etc. And the idea is that when the woman wakes up after her surgery, she still has the appearance on the outside that she has breasts, and she has the comfort knowing that the breast is gone and the risk from that cancer is removed. In the year 2006, the number of women dying of breast cancer has decreased every year. The number of women getting diagnosed with breast cancer has decreased every year. So we have sort of plateaued in this disease, and we've started to see an improvement in survival. And there's a couple reasons. Number one, treatment is better. The surgery's still aggressive, but the chemos have been much more specific and are much more tailored to the kind of type of cancer that you might have. And number two is screening. Women have got the message, and it takes about 20 years for an effective screening test to show a result in survival. And the way that works is by finding the cancers at the earliest stage so that the treatment that's offered cures that cancer and makes it a non-issue for survival. And that's what we've seen. It's taken 20, 30 years to see that improvement, but it's here now.
Today is a Community Awareness Day in memory of Barbara Colometto, and all the proceeds, 100%, go to the Philadelphia Cancer Transportation Fund, which is for people who are dying because they don't have the money to get their chemotherapy or get their regular mammogram or follow-up checkups, which is a sad fact that's occurring in our country today. So my wife Barbara Colometto, who passed away, she actually came up with this idea a year ago, and we've expanded on the whole idea. And to date, in 2 years, we've raised over $66,000, not counting today. We don't know how much money we've raised today so far, but hopefully more. But the real thing is to bring community awareness to the problem of breast cancer and also the lack of transportation for people that need it.